Hello, Jojo DD families. Welcome. We have a special treat for you today because today I am here with Dr. Sheva Assar, and who is a psychologist. And Dr. Sheva, thank you so much for being with us.
Of course, I'm so happy to be here.
We are hoping that this conversation that we're going to have right now really brings a just kind of lets us know how we can take care of ourselves emotionally during this time of uncertainty in the world. So before we kick things off, Dr. Sheva, can you tell our viewers just a little bit about yourself, your background, your practice, just so that we know who we're listening to today?
Yes, of course. Hi, everyone. I'm Dr. Sheva Assar. I go by Dr. Sheva. I'm a licensed clinical psychologist, and for the last few years, I really have just different experiences. I've worked within hospitals, university counseling centers, VAs, different medical settings, and my passion is really around working with millennials, younger adults, adolescents, and so I'm so excited to be doing this with you, Jojo, because I know a lot of your work is with children and their families, and I am very passionate about wanting to just to provide more education around mental health and ways to take care of ourselves, because I feel like if we can start early on, then by the time we get to adulthood, we have really strong coping skills in place to really take care of ourselves. I am a staff psychologist at a university counseling center, and I also have a private practice here in Newport Beach, and I live in California. So that's a little bit about me. I also provide a lot of I have an Instagram, a professional Instagram, where I focus really on relational wellness and helping individuals to learn more about themselves, but also learn about themselves within relation to other people.
Your Instagram is beautiful, by the way. When I go on there, I feel so calm and so relaxed after looking at your posts. So
Thank you. That makes me feel so good, because I really am wanting the Instagram to be a place where people can come, learn something, connect, and really a supportive space to talk about mental health and just about really feeling like our best selves and doing things to take care of ourselves in that way. So
that's awesome. And I thank you so much for being with us. I really hope that this helps our community. I'm so glad that you guys are tuning in. I did not want to leave anything out. So I actually do have a list of questions because I just want to make sure that we're servicing you and covering everything. So I think the first thing I want to ask you, Dr. Sheva, is routine. So being someone that works with children in a school setting a lot of the time and in a dance studio setting, right now I feel like, well, maybe not so much right now. People are kind of getting back into our new normal.
Mm-hmm.
But when everything first began, nobody really had a routine. Everything was coming at us just so quickly. And do you feel that it's important that we structure our days during this time of uncertainty that we're going through?
Jojo, this is a really great question. I think that this comes up a lot. I've had many people, there's a lot of discussion around what do we do in this time of uncertainty? Should there be fixed structure? Should it be semi-structure? And I think for me, I oftentimes encourage people to have structure in place, especially with children, for there to be structure in place, but to be flexible with that structure. So maybe having certain things that need to get done and having that to be part of your schedule, and then leaving some free time. So when we think of children, and making sure that, there's structure in their education and helping them to, have similar to their classes, right? Virtual classes or periods where they're just focusing on their classes, and then having time where it's like their free time or leisure time. I think, just more generally though, when I talk to clients, I really encourage them to be flexible with their schedules. So going back to, definitely having things in place, like making sure you're waking up at the same time every day, taking a shower, getting ready as if you are going out, because that does impact sort of our mindset, and checking in with ourselves every day. And so that's where the flexibility comes in, and really asking yourself, what do I need today? What is going to help me today? And that may look like, one day that may look like I'm deciding where I'm going to spend the day just watching Netflix, but you're intentional about that decision and you've made that decision. So it feels like it's part of your day schedule, right?
Mm-hmm.
So I think the biggest part of it is really having certain things that you're definitely doing, and at the same time, regularly checking in with yourself every day and seeing, what do I need today? And that could look like more structure, that could look like less structure. Some other things that I would just really encourage to be part of a routine, regardless of how structured or flexible it is physical activity, making sure, you're doing something where you're taking care of your physical body through movement or whatever it may be for you. Having time to connect with other people. And I think a lot of times, this idea of social distancing has translated in some ways to emotional distancing, and we don't want that to happen. So being intentional about including that in part of your routine of connecting with other people. So like, be it an appointment with a friend or with your partner or whatever it is. But outside of those main things, I really encourage flexibility where there can be flexibility.